Good evening, everyone. I'm Kristen Perfettio, and welcome to One Healthy Boston's Facebook Live. We are here again. One Healthy Boston is a community resource developed to help you achieve overall wellness and health, and it is brought to you by a partnership with WCVB and South Shore Health. We thank you for joining us tonight. It is a new year, new you, right? Perhaps?
That's right.
All right, January 2016. People usually make a lot of resolutions to achieve good health in January, and guess what? Weight loss and healthy eating and exercise is one of them. But what happens when those tactics don't help you achieve what you're aiming for? So we're going to be talking about bariatric surgery tonight, and I am joined by Dr. Neil Goucher. He's the medical director at the South Shore Hospital Center for Metabolic and Bariatric Surgery. We welcome our viewers to send in their questions, their comments. Dr. Goucher is going to talk all about this wonderful opportunity that we have at South Shore Health, correct?
That's right.
All right. Dr. Goucher, we're just going to get right to it because
Sure.
I have a feeling we're going to get a lot of questions tonight. Can you explain why someone exactly might need bariatric surgery?
Sure. Yeah, and thanks again for the opportunity to talk about this topic, because I think, again, in January, this is about making changes. And people, there's still a lot of stigma associated with bariatric surgery, with weight loss surgery, as it's often talked about. And one of the goals is that we really talk about patients that are struggling with weight, struggling with more than just obesity, with medical problems that are sometimes associated with it. And it's more than just an operation. I think that's one of the key points that we really try to make sure people understand, is that it's a whole lifestyle change. It's diet, it's exercise, it's the psychological changes that go along with it. And surgery is a very important tool in that, but all the other pieces have to be in place for people to be successful.
And there are two types of bariatric surgery, right? Can you just talk a little bit about what that is?
Sure. So, at this point, this day and age, really, we do two operations when it comes to bariatric surgery. We do sleeve gastrectomy and gastric bypass. Both of those are done laparoscopically. In terms of safety and complications, they're generally very safe, but they still have complications, they still have issues, and that's why we really try to be rigorous about the preoperative care and the workup beforehand to try to minimize those as much as possible.
Okay, so if a patient is looking to have a procedure done, or one of those procedures done, what exactly are some of the things they need to keep in mind?
So the first thing is to really identify and know that it's not just a standalone operation, that it is a tool. And so that's the one thing I really try to talk about, what you need to do, not only to be successful with the operation, but to be successful lifelong. So that's really the key, is that you know the sacrifice that you're making, that you realize that this is a lifestyle change in conjunction with a lot of other things. And that's the important part. And, in terms of, I think we have a question from someone on Facebook.
Yeah,
Sarah.
it's from Sarah. Yeah, how much do you have to weigh to qualify?
Right. So, this is a lifestyle change that is a medical change too, and it's more than cosmetic for sure. And the weight is one of the first criteria that we look at to see if you qualify for surgery. So the first thing that we'll look for is what's called a BMI, and that's a body mass index, and that's a way of comparing your weight in relationship to your height. And so to qualify for surgery, you need to have a BMI of 35 or greater, and have a medical problem that's associated with it. Such as hypertension, sleep apnea, those are probably diabetes, those are the common ones. If your BMI is greater than 40, then that's kind of the first kind of checkbox to see if you qualify for surgery.
Okay, we have a question from Heidi. How long is the healing time from some of these procedures?
So, the better and better we've gotten with it, this, bariatric surgery and weight loss surgery, we've done as surgeons for a long time, but doing it laparoscopically, getting better and better with knowing what to look out for complication-wise, the recovery is generally pretty fast. So with a laparoscopic sleeve gastrectomy, which is probably the more common surgery that we do nowadays, we're probably talking about an hour of surgery time, and we're probably talking about most of the time you're staying in the hospital for just one night, sometimes 2 nights, and the biggest thing is making sure that you're adapting to the diet stages afterwards, and then you go home. And then, certainly the first couple weeks you're recovering, you're dealing with just the changes with your diet, changes with all the things that are going on metabolically, which is one of the things we'll definitely talk about later, just all the changes that are happening internally that makes this more than just about weight loss.
Right, which we will get to. And we have a couple questions
Sure.
here about gaining the weight back. Does that usually happen?
I wouldn't say usual. So again, one of the keys with surgery and with any bariatric program is that you have follow-up afterwards. So one of our goals is that you're seeing myself, you're seeing the physician assistants, you're seeing the dietitians, you're seeing the psychologists at pretty regular intervals after surgery to make sure that if there is any issues with weight regain or anything that's just not going the way it's supposed to, that we're there to kind of nip it in the bud before it becomes a bigger problem. In general, when you look at the studies and you talk to patients, about 80 to 90% of patients at 5 years, 10 years after surgery have maintained that weight loss. So the vast majority have a really robust weight loss after surgery.
That's amazing. You talked earlier about BMI. If someone has a question about that, can they just get that done with their primary care physician, or is that something that they can do on their own to figure that out?
Yeah, so it's a very common thing to look. If you Google BMI calculator, you'll be able to put in your height, put in your weight, and that will give you an answer in terms of what your BMI is and what the other risks are associated with that.
Okay, we have a question. Is bariatric surgery covered by insurance?
Yes, so that's, again, because this is such an important medical intervention, insurance does cover it. There are different requirements based on your insurance of what you may need to do medically and preoperatively, but absolutely covered by insurance.
Okay. I want to get to the issue of, you talk about that it's not just a physical change that happens, but this is also very involved with the mental and emotional state that people are at. Can you talk about that, how you have to be sort of all-encompassing of mental health and physical?
Sure. So I think one of the biggest things I try to drive home is that it is absolutely the benefit is weight loss, but for a lot of reasons that almost becomes a secondary benefit. The medical changes that people have, I mentioned diabetes, sleep apnea, high blood pressure, a lot of different medical conditions are associated with obesity. Recently, cancer has been really tied into to obesity as well, and so especially if someone has breast cancer or has a chance of recurrence, weight loss really affects those. And bariatric surgery, because of the way it works, it's not just about the fact that we're making the stomach smaller or you're eating less. That's certainly a part of it, but the metabolic piece, the fact that the hormones are actually changing. So with both of these operations, the sleeve and with the gastric bypass, your body actually changes the way that you metabolize food. It changes the way that your body senses and reacts to the food. So cravings often decrease in patients. As I mentioned with diabetes, it's not uncommon for people to come in on 2 or 3 medications, sometimes insulin for diabetes. Okay. And even before they leave the hospital, day after surgery, we're stopping those medications because of the hormonal changes that we're dealing with.
Gotcha. Brittany has a question. What's the process and the, I'm guessing, process of time from start to finish?
So the lead up can be anywhere from 2 to 6 months, and it really, some of that's insurance company driven, but a lot of it is just, again, preparing you as best as you can to make sure that you know what you're getting yourself into, and that lead time is surgical consultation, again, meeting with the dietitians, meeting with the psychologists, all of which are designed to make sure that you really know what you have to do to be successful. So again, anywhere from 2 to 6 months. Usually we start with an informational session where we talk about all the kind of general questions that can come up, and then we move from there to the surgical consultation and all the other visits.
Awesome. We are One Healthy Boston Facebook Live. We are taking questions and comments about bariatric surgery today. We do have a question from Roberta. What about extra skin afterwards? That's a good one.
Yeah, another good question. We get that very, very frequently. So I definitely try to frame and try to focus the questions on, or the when people ask that question, about the health. And definitely people do have excess skin afterwards, and there's a lot of different factors in terms of if people have that or not. In general, the more you exercise in conjunction with the surgery, the more you do to kind of work out the excess skin, the more elasticity there is. But there are some people a year or 2 years after surgery where that's just not going away. And if that's the case, then we will refer you to a plastic surgeon and part of our team to kind of work on that aspect of it.
Excellent. You talked about earlier that usually after some of these surgeries you see a decrease in diabetes and other health issues. How, in your practice so far, how quickly do you start to see those changes?
It's dramatic. I think, again, the diabetes part of it is the most dramatic part, where you've got, just today I saw a postoperative patient that was on insulin, was on 3 oral medications to try to control their diabetes, and even then weren't having good sugar control. And again, a day after surgery, we were stopping all of the insulin, stopping all of the oral medications, and they're now 6 months out and are still off of all those medications. It doesn't work for everybody, and there's definitely some nuances to that, but in general, and that's why we call it bariatric and metabolic surgery. It is a lot more than weight loss.
That's amazing. We have a question from Patricia. Do you need to change what you eat? That's a good question too.
So I think, the difference is that this is not a fad diet. It's not something that you're going to do for a month or two and get, either not unable to continue doing it, or you just physically can't do it anymore. You're going to be eating healthy, but there's no restrictions in terms of what you're eating. The diet itself is still a regular diet, but you're going to be making healthier decisions in terms of portion size, in terms of the type of things that you're eating. Those are really the facts that we try to drive home before surgery so that you're prepared for it afterwards.
Do you find that that's a struggle for a lot of patients too, to make those conscientious changes? They love potato chips, and now all of a sudden they can't eat as many as they used to.
And that's where the surgery, again, really changes. It's more than just the fact they're eating less or unable to eat as much. Somehow, hormonally, metabolically, you actually the cravings actually decrease in a lot of people. Just that feeling of feeling full after, eating one slice of pizza as opposed to 3 or 4 slices of pizza, all those kind of factors really change the way you approach the food. It becomes, one of the expressions I've heard before is that you don't eat to live anymore. You live to, you don't live to eat, you eat to live.
Right.
And it's really about nutrition and making healthy choices, as opposed to that being the main focus of the days for some people.
Right. Amazing. This is from Christian. Can a breastfeeding mom qualify?
Yeah, there are definitely different nutritional aspects that we have to take into place, to take into consideration. But, the common thing is, is this the right time? I've got other things going on in my life. I've got other stresses. And there's never going to be a perfect time. There's never going to be the exact moment that's going to fit in with all the other things going on in your life. But from a safety standpoint, absolutely. I think the biggest complaint or issue I get after surgery is, and this is not tongue-in-cheek, but it's true, is that I wish I would have done this 5 years ago. I wish I would have done this 10 years ago, because it's all these other changes that happen.
Sure.
It's really hard for them to picture themselves doing those things.
Right. They must be so happy.
I think, I've told you this before, one of the most rewarding things about doing this kind of surgery and doing this kind of work and getting to see patients a year, 2 years, 3 years, 5 years after this kind of surgery is the life changes that they've made. Not medically, not the weight loss, of course that's important, but people getting back to enjoying life. Just today I had another patient tell me, my whole goal for doing this is being able to scuba dive.
Yeah.
And she used to do it 20 years ago, and that was her thing.
Yeah.
And because of the weight gain that she had, she was unable to do that. But since surgery, actually 2 months after surgery, she went to the Bahamas and was scuba diving. Amazing. She's got another plan for July. So getting people to re-engage with life again, to do the things that they really enjoy doing, that's again, for me, that's the part that really makes it fun and real.
So rewarding, yeah, absolutely. We have a question from Sherry talking about people who are 2 and 3 years out living their best life. She is 3 years post-op, and she wants to know, does she need to take vitamins for life? Is that part of the protocol? So,
part of the follow-up after surgery is that, especially early after surgery, we're going to be seeing you very regularly. Every 3 months, we're going to be checking your nutritional labs, your vitamin levels, a lot of different factors to make sure that, after surgery, that you're adjusting the things properly. But even a year, 2 years, and 3 years after surgery, there are still things that we need to look out for. So to answer the question, yes, you will be on a multivitamin really for the rest of your life. Calcium is one of the things we supplement a lot. Vitamin D, just living where we do, that's a very common thing that's deficient anyway. That's one of the things that we replace and have you take a supplement for.
Awesome. What does the surgery cost?
So again, for most people, it is covered by insurance. So if you have a copay or a deductible, that may be part of it. But for the vast majority of people, it is covered by insurance. So the out-of-pocket costs are relatively low. Certainly there are going to be some supplements and some things that you may need to do after surgery, and that may be something you have to pay for. But for the vast majority of people, it's covered by insurance, and that's, again, it's not cosmetic, it's not frivolous. This is important. It's the most important life change and intervention that people can do, especially if you're dealing with obesity.
Actually, I had a question about that. I've heard the term, and I have to look up on my notes here if I can find it, but I think it's called life journey or decision for life, or that is used with bariatric patients quite a bit. Can you talk a little bit about that? What does that mean exactly? Your life decision, or decision for life?
Well, I think, again, there's very few things that you can do that affect so many different aspects of your life. This is in conjunction with other things too. Smoking cessation, weight loss, if you have a drug or alcohol problem. All these things are things that they're not easy to change, and they take a lot of help, and they take a lot of willpower to do. But it is these things that not only affect your short-term problems, back pain, other issues, just mobility issues for some people, but again, cancer, heart disease, all these different things that are affected. And to make the sacrifice, to make that kind of life change, you're making not only, again, a decision, not only for the short term, but for the rest of your life.
Decision journey was the term I was looking for.
It's a journey, it really is.
Yeah,
it really is.
Absolutely. Samantha has a question. How old is too old for the surgery?
So, age is a number. It's one number that's in conjunction with a lot of other factors. We definitely don't have a set point in terms of the upper limit for age. I've operated on patients in their early 70s. It really depends, again, on what your goals are, what the other medical issues are going on in your life, and what we think your risk is. But, in the early 70s, there are still a lot of changes that you can make and that this can help with.
What about patients who are perhaps unable to come in? I know that your practice has some type of tool that they watch online that can give them the ins and outs of what they would be signing up for, what the procedures would be like. Can you talk about patients who maybe are not as apt to get out of the house to get to an information seminar about this?
Right. So, just even in this 30 minutes, there's a lot of facts and a lot of things that you need to know, and it can be overwhelming. We usually start with an informational session that we offer in Weymouth. We also offer them in Boston. Again, to your question, we have an online informational session as well. So we really, again, try to cover the basics and all the details too of what surgery is and what to expect, and then there are some kind of interactive ways to do that through our website, through South Shore Health.
That's terrific. Jen has a question. How can she get a referral?
So the beauty of this is that for most patients, again, depending on your insurance, you may not need a referral. I always recommend that people talk to their primary care physicians, that they get them involved with that decision. But for the most part, if this is something that you've been interested in and thinking about, you can call through our website. You can either sign up for an informational session or just talk to our new patient coordinator, and they really try to streamline things to get you in, get all the appointments scheduled to try to make it as easy as possible.
So, getting back to sort of the beginning of all this, when we were talking about bariatrics and exercise and weight loss and healthy eating, why can't someone just work out and eat healthy and lose weight? Why is it for some it works and for others it's harder?
So it's really hard to battle your family history, to battle your genetics. The way I like to talk about it is as a thermostat. And your body and your kind of way you're put together is set to a certain temperature, set to a certain metabolic temperature of what you require calorie-wise, what you need to eat, and what you need to do to maintain any kind of weight loss. So a lot of people struggle with, they go on a diet or they do an exercise program and they fluctuate. They're able to lose 30, 40 pounds sometimes, but then they gain it back again, because unless you're on that strict diet, unless you're working out 3-4 hours a day, it's really hard to fight your internal metabolism. And that's, again, where surgery kind of changes the set point of your thermometer. Your body, for again, a lot of reasons we don't quite understand yet, it changes the way your body thinks about food, and it changes the way your body actually metabolizes it. So your metabolism increases because, again, of the hormonal changes that happen after surgery.
Okay. Please, Lucy wants you to please review the qualifications for patients again.
So, again, BMI is the first sort of checkbox that you need to have. So if your BMI is greater than 35 and you have a medical problem associated with obesity, so sleep apnea, hypertension, diabetes are the most common ones, then that is, again, the first kind of qualification. If your BMI is greater than 40, and again, BMI you can calculate by going on Google or on the web anywhere and finding those ways to plug in your height and your weight, those are the first kind of qualifications. After that, it really comes down to that interaction that you have with your surgeon or with the bariatric team to see if there are any other specific things. But that's really the first kind of check thing, is your BMI.
Okay. Roberta and Sarah want to know, what are the risks?
So none of us take the surgery lightly. This is still surgery. If there was a medical intervention or some other way of having the same sort of metabolic and weight loss endpoints that we have with surgery, we'd be doing it. Right. And so the trade-off is that it's surgery, and surgery certainly has risks. We do it laparoscopically, so we're talking about usually 5 to 6 small incisions on the belly. There are risks with bleeding, infection, injuries to the things near the stomach. Those things are possible. Luckily, if you add up all the risks that can happen with surgery, it's much less than 1%. And my other answer to that is, if you add up your risks of not doing anything about your obesity, so the risks of having a cancer, of having heart disease, of having all the other things we talked about, for most people, that short-term risk of the operation is far outweighed by the benefit of preventing those problems from happening down the road.
Okay. Has the surgery come a long way? I mean, I think I remember years and years ago, it just seemed to be a little more, you talk about 2 days in the hospital max. That's amazing.
Yeah. 40, 50 years ago, it was done, but it was done through an open incision. Again, it was really kind of unsure what the outcomes were going to be. There wasn't as much research. There wasn't many outcome studies about how things look, not only a year after surgery, but how they look 10, 20, 30 years after surgery. And now we have that. So we know that after a gastric bypass, 40 years after surgery, we know kind of what to expect and what your weight loss should be and how many people can maintain that weight loss. The sleeve gastrectomy is slightly less. We don't have as much longer-term information about that. We've been doing that for probably 10, 15 years. But still, it's tracking in a very similar fashion in terms of a robust operation that solves a lot of problems.
Katie has a comment. She wants to know about bowel obstruction as a risk.
So, when we weigh the two, that's one of the reasons for the surgical consultation, is really kind of weighing your risks when we decide, is a gastric bypass or sleeve gastrectomy a better fit or a better option.
Right.
I will say for most people after sleeve gastrectomy, where we really are only operating on the stomach for the most part, the risk of getting a bowel obstruction is very low. It's slightly higher with a gastric bypass because of the way we're doing that operation, but it's still pretty rare.
Is there one that works better than the other?
So again, because of the more research we have, the gastric bypass, that does seem to be better in terms of the weight loss people have.
Okay.
It does seem to be slightly better in terms of some of the other medical problems like diabetes in terms of controlling that. But we're talking about percentage point differences for the most part. So when, again, people are worried, should I pick one or the other? For most people, the only wrong answer is not doing something.
Gotcha.
Because the risks and the differences are, again, small numbers that we're talking about.
And do you pick one over the other based on someone's particular, metabolism or genetics? Or?
Yeah, the metabolism part's harder thing to pin down, but certainly certain medical history parts may factor into what's better, one or the other. We talked about age, that may come into it.
Okay.
Some of those, and again, a lot of it's nuance. A lot of it is just kind of really having a heart-to-heart conversation with you in the office, figuring out all the little details, and then trying to tailor the operation appropriately.
Okay. We did get a question about lap band. Is the lap band old technology?
So there are still plenty of patients that have had one. 10, 15 years ago, they were very popular, and there are plenty of patients that have had good results with it. With sleeve gastrectomy being more kind of as a safer option with some of the other nuances of the surgery that we have, I will say that I don't do them very often, and I have taken out quite a few in the last few years for various reasons. But so if that's something that someone is interested, we have that conversation. But with the sleeve gastrectomy, with the gastric bypass, I just think that there are better options out there nowadays. Okay.
Ben has a question. Why surgery and not diet or fasting?
So that goes back, that's a great question. It goes back again to that whole metabolic component. For some reason, and again, the data and the research are still being kind of teased out, but by removing the part of the stomach that we remove with the sleeve gastrectomy, and by doing the gastric bypass, by bypassing the part of the intestine and the stomach that we do with that operation, it changes your metabolism. So the whole problem with dieting, the whole problem with exercising, again, they work for a lot of people, but for some people, and for a lot of people, unless you're on that rigorous diet, unless you're on that rigorous, exercise program, forever, it's really hard to maintain that kind of weight loss. So people have initial weight loss, they're able to lose a lot of weight, but it's the maintenance part that, I go back to that whole thermostat idea, it really changes your body's sense of where it should live and what it needs to do to keep up with its metabolism.
Okay. Donna has a question. 15 years post-op and the weight is back. Do you have any advice?
So again, as we said, this does happen, and it really depends on where you're coming at it from. If you aren't still connected with your bariatric program, I strongly recommend that you do that, because it's really about making sure that you're not falling into old habits, that you're still doing all the other things that you need to in terms of diet and exercise and all the other pieces. Sometimes there are anatomic things, there are surgical things that need to get adjusted or changed, so that is sometimes the situation as well. But the key for most people is getting back into line in terms of the lifestyle changes that you initially made. But just like anything else, the further and further you get out, sometimes those become just not as prominent in your life. And the surgery is, you have to look at it that way. It's a tool. And as you get further and further out from surgery, sometimes that tool becomes a little less powerful, and that's why those other habits become so much more important.
Gotcha. We are One Healthy Boston Facebook Live. We're taking questions with Dr. Goucher about bariatric surgery. Michelle has a question. Any increased risk of ulcers?
These are great questions. So with the ulcer risk, we do see that sometimes more with the gastric bypass. So in that operation, we're actually connecting the small intestine to the stomach. And that part of the intestine initially wasn't really used to seeing food in that kind of undigested state. So we do see that. We really very rarely see it with the sleeve gastrectomy. And most of the time, if there are lifestyle things, so things like smoking, people that need a lot of ibuprofen or NSAID kind of medications for pain, those are the factors that if that's going on, that's something we definitely need to address. If you're not doing those things, they can happen anyway. So it is one of those factors that if you're not, if things aren't moving the usual pathway, that you get checked out and we evaluate it.
I love all these questions. Tracy has a question for, can you go from bypass to sleeve?
So I think the short answer to that is really no. Just the way that we do that operation is very challenging to recreate the anatomy to do that. There are occasions where we have to convert a sleeve to a gastric bypass, but in general, we hope to make it a one and done kind of operation. To the questions that just came up, there are certainly things that come up that may require us to do something to change the anatomy, but we take that on a very case-by-case basis.
Talk to me a little bit about what South Shore Health does when a patient comes and signs up, looks into getting bariatric surgery. The process, again, how quickly does it happen? Is it a couple months before they get the surgery? Is it counseling for quite a few months before the surgery? And then post-op, how long are they checking in, coming in for appointments? Is it years or months?
That's the hope, is that you really, we see you lifelong. So it is a process. And so part of that preparation before surgery is to know that you are as prepared as you can be before surgery. So it can be intimidating. It's one thing to think about surgery and to think about, I want to do this, but to actually then make the steps to do it, we completely understand that it's a very scary and intimidating process. So we try to streamline things as much as possible. From the website, you can get in contact with our new patient coordinator, and they really try to step you through all and trying to schedule the consultation. So, the consultations that you're going to have before surgery are with the surgeon once or twice or 3 times, again, however many it may need. With a dietitian, same thing. Could be a couple, 3 visits before we're, again, sure that you are comfortable with all the things that you need to do before surgery and after. With a psychologist, that may be 1 or 2 visits before surgery. And it's a very similar process afterwards. So we plan on seeing patients every 3 months for the first year after surgery, then every 6 months for the next year, and then yearly after that. Because this, again, is a lifelong thing, and there may be things that come up that are different at year 4 compared to, 6 months.
Right.
So that's why we're there along the way.
Kim has a question. Do you have can't even say the word, comorbidity like diabetes?
I think the diabetes part of this whole surgery intervention is the most dramatic and the most interesting. So a significant number of people that struggle with obesity have diabetes. And again, that ties into the whole metabolic part of what we're talking about with these operations. And that's, as we mentioned before, the treatment of diabetes and the kind of maintenance of your blood sugars is such a dramatic influence after surgery compared to doing medical management and some of the other things, the insulin and everything else. That is by far one of the more common comorbidities, medical problems that we see with people struggling with their weight.
That's amazing. Wow. So how long does surgery take from Dave?
The surgery, again, is laparoscopic. The sleeve gastrectomy, usually about an hour, so relatively short operation. Gastric bypass, again, laparoscopically, may take a little bit longer, maybe like 2.5 hours. But the general aftercare is very similar between the two. Usually you're in the hospital for 1 to 2 days. Biggest thing is, again, making sure that you can keep yourself hydrated. You are going to be on various different diets along the way afterwards, mostly protein shakes for the first week or so after surgery. And then you're kind of off and running after that. But the surgery itself, about an hour to 2.
Is there any issue with pain at all? Do patients usually have any uncomfortability afterwards, or do they feel pretty good?
So for the most part, if people have had other laparoscopic surgery, it's very similar to that. So again, we're talking about 5 to 6 small incisions. There's still incisions on the belly. They still hurt. We've actually are trying to start a new initiative of really trying to avoid any opioids, any narcotic medications for this. And that's been amazing. So there's some pain, but for the most part, it is not the thing that drives, that people struggle with.
You've been doing this for a while now, and you've seen some really great, successful patient stories. Give us the message as to why someone at home considering this should go for it.
So this is sometimes the hardest, but most life-changing decision that you can make. And as I mentioned before, it's not just about your weight. It's about your medical problems. It's about your life. It's about your psychological well-being, your mood. Again, as the guy doing this, it's easy for me to say, but it's the most impactful thing that you can do for your life because it affects so many different things. So if you're nervous about it, if you're scared about it, it's totally appropriate. But we're here to help you along the way to try to make it as straightforward as possible.
We could have spent an hour or two talking and taking all of your questions. We have to wrap it up. It's our time to go, but we want to say thank you so much for sending in your comments and questions. Dr. Goucher, thank you. All of this was so valuable.
Thank you.
Thank you. Don't forget to tune in to One Healthy Boston for next month, and you can learn more about this, onehealthyboston.com. Thank you to WCVB and South Shore Health. We'll catch you soon.